It's a pleasure to be joined once again by Dr. Warren Johnson and Melissa Moore. First of all, in January, many people like to make New Year's resolutions, and we're here to discuss an eye pledge to get in shape. First of all, let's just take some pieces of that one by one. What about the importance of visiting your eye doctor at least yearly?
That's something that I think we talk about a lot of times when we speak with you and are pleased that you help us reach out to the community in terms of giving them information. The importance of that, I think we might have said this before, but people know to brush their teeth every day, even if they don't feel like they have a cavity, and they floss their teeth and see their dentist once or twice a year, and they tend to assume that if their vision's okay with or without glasses, that their vision's fine. But all glasses do are focus light in an eye that may or may not be healthy. You can still see sometimes, and you could be losing your vision to glaucoma or macular degeneration, and even if you're not old. We've just had somebody 20 years old the other day that was going blind in one eye, and parents have been very good about keeping this 20-year-old young lady's eyes examined, but it was just not picked up on before. So the importance of seeing your eye doctor yearly, we find that if you tell somebody just come back when you can't see, unfortunately still, and I'm glad you're our advocate here, because the more that we can get across showing people the digital images, showing them their eye health and something they can visually observe, running tests to test for early detection or at-risk levels of macular disease, helps them then understand that glasses only help what I can keep healthy here. So the importance of seeing your eye doctor yearly is that you can catch and pick up a lot of sight-threatening problems that could be related to your overall health, like your blood pressure, diabetes, cholesterol. We have lupus patients, we have cancer patients. Those things can affect, besides the ones that are then fully blown into eyesight-threatening problems, referred to as glaucoma, macular disease, cataracts are the best examples. You agree because of your eye health?
Absolutely, and a lot of people, what they try to do is follow their insurance plans. Some people have insurance plans. Most of them will cover an eye health exam every year, but some do where they cover it every other year. So even if you have one of those type of plans that, your insurance only covers every other year, it's so important to have your eye health examined every year because the eyes change so frequently. They change daily. And it's like Dr. Johnson was saying, there's just so many undetectable problems that we can, if they're caught early enough, can be, help to slow down or, even prevented.
One of the many things people do to get in shape in general, and I'm not talking about eye health, is they want to eat better, to lower their blood pressure, to lose weight. But how does eating better relate to eye health?
I will tell you that we now have an instrument in our office that tests the macular area. That's the area that glasses focus in. People may have heard of macular disease or degeneration. Sometimes calls from ultraviolet light, blue light from our electronic devices.
Exactly.
Outside ultraviolet light, actually more damaging from our electronic devices to the macular region. And we have an instrument that tests to see if that area of the eye is healthy, okay? So if the pigment is not good and dense right there, and that's really one of the densest areas of pigment in our body is in the macular region, then we know that their health's not good, that we know their diet may not be good. We may know that in questioning them after we see whether or not their score is normal or low, we question these things, and then we put them on alert that they're at greater risk for losing their vision. And then we have suggestive supplements that contain zeaxanthin and lutein, which basically are your green leafy vegetables, consuming those. But we also have supplements because the number of portions a day you'd have to take in for that would be about 8, 9.
Yeah.
Nobody eats that much lettuce,
right.
but or carrots or different colored peppers.
If you want to eat 10 yellow bell peppers a day, then you don't need the vitamin supplements. But most people aren't able to get that many. So, there are vitamin supplements that we recommend, but the majority of people, when they do come in and have their pigment density tested, it is substandard, subpar to what it should be, because we aren't getting, the nutrients that we need out of our diet. So most people in our country definitely do need the supplements and need that pigment density to be thickened, to help to prevent macular disease down the road.
See, Vance, the macular region is 100th the size of a pinhead, and that's where people's vision's focused with or without glasses. And when we show them the digital photograph, we can show them how small an area that is and what great risk there is in so many other parts of the eye that they can't even detect. So, like Melissa's saying, in picking up, and we're talking about general eye health here, but the macular region and the optic nerve, that's where the picture's taken to the brain once it's focused in the macular region. Then if we don't keep that healthy or know that it is or isn't healthy, then people are slowly losing their vision. Here's a stat for you. 77 to 78% of the nation's population are in jeopardy of losing their vision to macular disease. Over the next 20 years, it's predicted that about 18 million people are going to lose their vision to macular problems. One of the biggest sources of this are, one, people not knowing they really need full facial coverage outdoors for ultraviolet protection, whether it's cloudy or sunny days, in the form of some type of sun protection that is an approved, not a stickered label from pickup sunglasses, but is an approved UVA, UVB protective screening built into the lens. But the other is there's new lens technology that we, because we have a custom lab on site, have now been made privy to, one of the first that's the case, and it blocks blue light. And the small wavelength of that coming from our electronic devices, that's our desktop computers, that's our iPads, that's our laptops, that's our telephones, is really causing the most damage. And that's why they think the younger population is really going to lose a lot of their vision a lot sooner if they don't have access and someone hasn't screened for this, told them that, and told them what means, either be it supplements like Melissa has discussed, and we've just discussed the green leafy vegetables, which you can get from the supplement that we would be prescribing, and or you're having a good healthy diet and lifestyle.
And the blue wavelength of light, too, that Dr. Johnson was talking about, I mean, we're definitely exposed to that more than we ever have been before. And, kids growing up are exposed to it at a much younger age than we ever were. We started seeing phones and computers and things as adults, but these children are being exposed to it from the time they're born, basically. So all those years of exposure is just going to create that much more damage in the macular. I have a feeling over the next several years the macular disease rates are definitely going to climb because of that.
And talking about that, what would you advise anyone, whether they be children or adults, how would you advise them to monitor their time in front of a computer screen? Or what about looking away from the computer screen? How would you advise children and adults to deal with that issue?
You definitely want to try to blink more when you're at the computer screen. And the blue light blocking glasses, the computer lenses that we definitely recommend to most people, is going to help to protect your eyes from some of that. It's also going to help to reduce the eye strain, make your eyes feel less tired and less dry at the end of the day. If you're on a computer screen for any more than 3 to 4 hours at a stretch, we really recommend the blue light blocking lens technology.
And I think Melissa touched on a good point about, and you did too, Vance, about looking away from the computer. It used to be that's all we had. We would tell people that after a couple of hours on the screen, that was more or less because the best knowledge that we had of preserving vision health was to keep people from becoming worse in terms of need for corrective lenses. But and that was, like Melissa's saying, the blinking. That's like you're saying about getting up and looking off at a distance for 10 minutes, going to the bathroom, get a drink of water to relax your eyes. But what we have more recently found is, and again, you touched on this too, how can we change the way we work? That's not going to change. Everybody's going to continue. There's going to be more and more technology that comes out that we will be using. It's all pixel points, blue light emitting, even lighting in our offices, like fluorescent lighting. Those are all causing damage to people's eyes, in which, generations past, they weren't exposed to that so much. A lot of people say, well, I see fine, and my computer doesn't bother me. Well, visually it may not.
Right.
Maybe their neck starts to hurt a little bit if they're looking through a bifocal, but they even need some type of blue lens that they're looking through, even if it doesn't have correction in it.
Nicotine is very addictive, and one of the New Year's resolutions that many people make is to not smoke, and that's mainly because of the risk of heart disease and lung cancer. But how does not smoking help when it comes to eye health?
Well, you're well read. That's good. I mean, speaking to the heart disease factor, that's great, Vince, that you did mention that. Lung cancer, what smoking does, it releases free radicals, like in cancer. Okay, and so you have oxidation. This is getting all scientific here, not to get too deep into that, but so it starts to break down the pigment in the central vision in the macular region. We keep getting back to the macula, but smoking does tend to cause that and cataracts. And what we find is most smokers, when they come and get an eye exam, they're aware of the lung cancer, like you mentioned. They're aware of the heart disease. They've never thought about the fact that they could lose their vision because they're smokers.
Right.
So a big thing is, we know we can't change their lifestyle. We know that we can't follow them around and say, no, don't buy those, But what we do know is we can inform them. What we do know, this is something that a lot of patients we see don't know, that we've done a lot of studying on, that synthetic beta-carotene found in most multivitamins can precipitate the free radicals. They can precipitate when someone smokes. They're called free radicals. It causes, increases the risk of, I guess exacerbates the risk of lung cancer. Not only macular degeneration, synthetic forms of beta-carotene. If you go look in the store and people are buying these big jugs of all these multivitamins, and especially I think a lot of smokers are saying, I know this isn't healthy, so let me take a vitamin. And if it has beta-carotene on the back, that could actually cause them to develop lung cancer, not just the macular degeneration, but I'm glad that you mentioned the lung cancer. So what we have, we've gone and found different multivitamin supplements that do not have that in there. Now, in beta-carotene in its natural state actually is a subgroup of carrots, okay, and different vegetables too. So in its natural state, it's fine. But it's in the synthetic state found in multivitamins that you pick up at the store. It's damaging to smokers.
And now let me get to a couple of other points. What about wearing sunglasses and also using safety eye